But first, employees should be allowed to refuse the COVID-19 jab for medical or constitutional reasons. A new consolidated directive on occupational health and safety measures says workplaces must accommodate those who do not want to be vaccinated. This is such an important discussion. It was gazetted by Employment and Labour Minister Thulas Nxesi. Now, to unpack the new measures for vaccinations in the workplace, I'm joined by the department's Chief Inspector for Occupational Health and Safety, Mr. Tibor Szana. Mr. Szana, good morning to you. Thanks for your time. And this does provide clarity not just for employees, but for employers as well. Help me understand how this decision was made, because I'm sure you and I will agree that it's going to get very tricky when we reach a stage like herd immunity and some large corporations have those employees who want to take the vaccination, others who don't, and you can see where the fight in HR and the Labour Department is going to come in.
Good morning, and thank you for the opportunity. I think look, the vaccination issue was, to start with, a very, very tricky matter, even in discussion at NEDLAC. And within the NEDLAC process, of course, at the end of the day, when the document came out, it was agreed to by all the parties. That is, employer organizations, employee organizations, as well as government itself. So in this case, it's not a document that has been put out that government had developed. The document took quite a long time in coming out because there was disagreements in relation to what would be acceptable if an employee were to refuse to accept the vaccination. Now, going back, as you say, to unpack the understanding, of course, you raised the issue that there are certain conditions under which a vaccination can be refused by an employee, but there are bigger issues at play here that are described in the direction, and that is that it's bigger than myself or yourself or any individual. It is also about the employer who needs to protect not only his or her workers, but also the broader population, because people go to work. Let's take a retail setup, for example. A worker who contracts the virus there, then it goes on to expose the community. And in that particular instance, it becomes a knock-on effect, of course, and you could have the whole community affected as a result of COVID and, let's say, not accepting the vaccination.
Mr. Szana, let me ask you this question, Mr. Szana. Forgive me if I can come in there very quickly. I know it's quite a complicated matter. I'd like to just put this very simple question so viewers can just understand what could happen here. So I understood this as an employee can refuse the jab for medical and constitutional reasons, and you did allude to that slightly. So if I cannot provide that I have a medical reason not to take the jab, and I cannot argue a constitutional right to not force me to take the jab, will I be forced to by my employer?
The direction's pretty clear on the matter. It does say that any person that can be accommodated in other areas at the workplace, the employer must see if that can in fact be done. Now, it depends on the type of and the nature of the work that's being performed. I touched on the retail sector. I could touch on the airline sector and so on. There are certain types of work where it could become a requirement, or it will become a requirement for you to get the vaccination. International travel, for example, if you were to refuse to get the jab, as it were, as we call it, and you were to be involved in international travel, such as an air hostess, the country that you're going to could refuse you entry, in which case the work that you're doing, you won't be able to perform to the required level that you are required to, in which case the employer now has to make a decision. What are they going to do, because you are going to become extra in the organization, and someone else will have to perform the work that you're doing.
I can just
So
imagine the
there
fights the unions are going to have about this. Mr. Szana, I know we're going to have a conversation about this again at a later stage. I can just foresee the problem with the unions when we get to that stage, and I'm sure you will agree how difficult this is going to get. But I think you've just given a nice outlay of the basics of what this is. I know it's very complicated, and I appreciate your time. Labour Department, Occupational Health and Safety Chief Inspector Tibor Szana, trying to simplify it as much as possible in the time that we have. But we're going to continue finding out what that all means as far as employees are concerned.